Well, it looks like it's after 3, so I think we probably kick off with some introductions. And thank you everyone for joining us. As you can see on the screen, we are here to talk to you today in our latest Tech for Good talk on the future of digital healthcare. So thank you for joining. You will also see that we do have, and probably have heard from our intro discussions going on, we do have a fabulous panel here with us this afternoon that I will be introducing everyone to very, very soon. This is a bit of an extended session, so for you that have joined and signed up nice and early, it is actually 90 minutes now, so we do have lots of time to talk to our panelists, and that does mean lots of time to answer your questions. Please do get your questions in that Q&A channel throughout the session whenever they pop into your mind, but I will make sure there is time at the end for those to get answered. So firstly, just going to take you through quickly the event setup so you know what to expect. So agenda for today, we'll be doing some introductions to kick us off and just spend a little bit of time talking about the state of play and our experience in digital and healthcare, with a little bit of food for thought about the opportunities in digital healthcare. Then we will be diving into that panel that I've already teased you about a little bit and getting you all familiar with our experts. And we will leave, as I said, plenty of time for questions. So get thinking now about what those questions are and populate that channel. The Q&A one is the best, but we will keep an eye on the chat. But if you can pop them in the Q&A, we will get those across to our experts. So before anything, I guess I should introduce myself probably, because that's a good way to start. So I'm Gabby, I head up commercial at Three-Sided Cube. Rich, do you want to introduce yourself, because you're also on the screen, and then I can tell everyone a bit more about Three-Sided Cube?
Hi, yeah, I'm Rich. I'm the MD of Three-Sided Cube.
And I promise it won't all just be my voice, and we'll be handing over to Rich in a minute. But just a little bit about Three-Sided Cube and who we are. So we are a software development agency. We're based on the south coast of England in a place called Bournemouth that is sunny today. I always like to slide that one in when it is. We're a mission-led organization. So yes, we do the software, but we are a software development agency on a mission. And that mission is to change millions of lives for the better. It's what motivates us at Three-Sided Cube and what all the teams sign up for when they join Cube. We achieve that mission by building tech for good, because technology is a super powerful tool that has potential for huge reach and impact. But the technology itself is agnostic. The technology doesn't care if it's used for good or for bad. So we choose to work with organizations that actually align with that and have the expertise and the audiences to develop projects and products where technology can be used as a key resource to enable more impact and ultimately deliver real positive change to people's lives. Being in the for good world, you know, our team is extremely passionate about protecting people and our planet. And really that's what leads us to do these Tech for Good talks, and what's led us here today talking to you and our wonderful panel about the future of digital healthcare. So we actually ran a similar event, I think it was over a year ago now, I'm not quite sure where all the time is going, which was focused again on digital healthcare, perhaps slightly more in the digital transformation space, a little bit more linked to the pandemic and, you know, the huge amount of transition and change very quickly that had to happen to accommodate the kind of change in the space, and really that kind of need for more virtual because of the pandemic. During the pandemic, I think something that we've thought about in preparation of this was the strain on the NHS and healthcare services was very apparent. It was at the forefront of a lot of the public mind because we were hearing it a lot, but now what we're seeing is, you know, the ongoing pressures that are there and are slightly more obvious to us because we were so heavily exposed during COVID. So some stats, some scary stats on the screen for you. They are from the House of Commons Committee of Public Accounts report, which was published in March this year. So these are from the end of December 2021. And it was that actually over 6 million patients were waiting for care. It's the biggest waiting list that has been known since apparently records began. So quite worrying that. And only 64% of these patients had been waiting less than 18 weeks. So that's comparatively compared with the performance standard, which requires 92% to have been waiting for less than 18 weeks. So you can see that strain is still very much there. And similarly, only 67% of patients with an urgent referral, and this is for suspected cases of cancer, were treated within the 62 days compared with the requirement for 85% to be treated within that time frame. So this helps us to understand the pressures, the kind of need for some support in this really crucial service that we have. And now, as I promised, I'm going to hand over to Rich, who can talk a little bit more about the opportunities for digital and perhaps how digital can help with this demand. So Rich, over to you.
Yeah, so really, I think as Gabby has kind of alluded to, there's a sort of we're used to hearing the words unprecedented at the moment. There's a unique set of circumstances that have happened over the last couple of years, which is really like hugely affecting healthcare. It's affecting the whole world, but healthcare in particular, obviously. And you have the sort of impact that's happened through various macro factors. And then you've also had the advances in digital use and digital technology, particularly around communications, that was necessitated by the pandemic that we've just been through. But what that's meant is that there's big opportunities there that we can kind of leverage within digital and the healthcare sector to help to kind of alleviate some of the issues that are hanging around. And obviously, the panel that we've got here can talk about that with a lot more domain experience from the health world. I can sort of talk a little bit from kind of the digital world and some of the work we've done and some of the more interesting sort of areas that there are that kind of are maybe not just completely obvious in terms of what can be done with health. So I think what's kind of really interesting about digital, and if you look at any problem really, but particularly the problems around healthcare with this type of lens on it, it can really show you the benefits that digital can have. So we've all kind of grown up. This is asynchronous communication it's a bit of a buzzword. What that basically means is that people are now, we're in a much more flexible world, in the working world as well. And people, if we're going to live in a more flexible environment, have to get used to asynchronous communication. Now, what that means is I may make a request of somebody, they may not answer straight away, they would answer it in kind of their time. And what that means is that people can be, you don't have to, the logistics of communicating is a little bit easier to do. It's a bit more complicated as well because you can't find stuff out straight away. But in terms of being able to respond to people, digital makes that possible. And I've got some examples of that later on. Cost to serve is an absolutely huge one. Now that's something that sounds a bit kind of, it's not all about cost, and well, that sounds unhelpful, but cost to serve is something that's been being developed in the digital world, particularly in the kind of financial service sector, and that is something that I think we can really learn a lot of and take a lot of the learnings that they've made, not just over the last couple of years. They've been looking to reduce cost to serve for the last 10 years. And that is something that is becoming, as budgets get tighter and tighter and tighter, that is something that any kind of healthcare service or industry needs to think about how that can be reduced. And that is something that digital has had a huge impact with, but you have to make sure you're doing it responsibly, and you have to make sure that people are still getting that same level of service, but it is possible, if done right, to be able to reduce that actual cost of delivering the health service that you want to. Again, I've got some examples around that. And then behaviour change is a really massive one. Gabby kind of alluded to it earlier on, the impact that technology has around people's behaviour. And it's something that we are, very sort of passionate about. These things, mobile phones, had a massive impact on the way that people behave and the way that communities behave as well. Not always for the best, if we're honest. It hasn't been, it's not all good news, but certainly there's a lot that can be done via this type of technology that can have a real positive impact on people's lives. So just wanted to kind of, and there's obviously lots more to it than that, but there's some sort of broad brushstrokes of areas that we've been involved with that are quite interesting. So just to give you a few examples of some case studies, our and this is an app that we have been working on now for 7 years. This is our blood donor application, and this basically this is used in the States. And it is used by the American Red Cross to allow people to manage their blood donations and encourage them to make donations as well. So it's a kind of, when you're trying to organize, anybody out there who know, I mean, I have a particular issue with calendar management. It's not my strong point, but anyone that tries to organize, meetings and bookings and that kind of thing knows the complexity of people's lives these days and managing a diary. And this is a great example of that asynchronous communication, in that you don't need 2 people there at the same time to necessarily book a blood donation. Now, in the past, what the Red Cross would do is they would phone people, and it was done over the phone, or actually online as well. But what we found with the blood donor application is that people are much more they're happier to manage their donations themselves, and that's what digital allows you to do. You don't need somebody at the other end necessarily who's organizing that logistics. Once you've worked it out, the kind of business logic behind it, you can do that yourself. And the beauty of the app is as well, once you've booked your donation, you can follow through the journey of that blood as well. So it's not just making it easier to book the donation, you also see the impact of that donation, which encourages people to make further donations, which is a nice piece of it. And what it can also do is suggest to you intelligently future donations that you may wish to make. So it actually suggests the appointments for you. So there's some logic in there. We didn't call it AI when we did it, but I suppose these days people would call it sort of, it's not that complicated a thing. So AI makes it sound like it's some, ever-growing brain pulsing at the sense of the American Red Cross. Not quite that, but it does suggest to you when your next donation should be. And the blood donor app, we've been, as I said, been building it for the last 6 years. That's now managed there. It's the most used medium for booking appointments. And it's probably doing over about 230,000 appointments a month now. So and if you think about the cost they used to incur with call centers and people that were involved in managing those donations, it's really, really high. And actually, you don't just save that cost, but there is a much better show rate for people that have managed their appointment through the app. And that's down to a whole load of psychological reasons that you can go into, but ownership and stuff like that, and that freedom. What that also means is that the people turn up. So anybody that runs a practice or has ever run any endeavor where you're trying to get people to turn up to things, you really need is to have a really good idea of the actual volume of people arriving, because it means that they can then run their blood drives in a much more efficient way. Again, saving costs for them and making it's a much more effective point of delivery. So that's a really good example, I think, of how we've helped the Red Cross certainly serve both their donors and the blood drives as well through the app. Another example, this really is a cost to serve example. So the Child Brain Injury Trust is a fairly small charity in the UK. There's about 27 people there. And what they are interested in doing is supporting parents through the life cycle of their child if the child has a brain injury. So the interesting issue around brain injury is the actual long-term results of that injury aren't often known when it happens. The brain develops at different ages. So if a 5-year-old is unfortunate enough to suffer a brain injury, they may not see the results of that until they're first going through puberty and then later early adulthood as their brain develops. And so the cost to serve of that, of a parent going through that in that long term, it's like 10-15 year cycle, is really, really high. And what the CBIT is the Child Brain Injury Trust, what they were looking to do was to be able to provide a level of contextual support that didn't mean that you had to have a consultant on hand all the time. And I know we've got some great examples of that to talk about later on as well, chatbots and things like that that can support that. And it greatly reduces their cost to serve. And what that means is that they can have a greater impact on a wider group of parents. So they've got much bigger reach through this platform. And it also means that their consultants aren't spread as thin. So they can really, the consultants can concentrate on delivering the care exactly where it's needed. So this allows you to do, it's contextual based, it's basically like contextual content delivery system, for want of a better word, that really helps parents at the point of need. It provides them with the information that they want. And then one last example that I wanted to give, and this is one I kind of always talk about whenever I'm talking about with healthcare stuff, and this is quite a well-trodden, pardon the pun, example. This isn't one of ours. This is just something that I think is a really interesting area. This is actually provided by the government, the NHS, sorry, and that is the Couch to 5K app. Now, people don't automatically think, well, this is a healthcare app, but what this is doing is this is a great example of behaviour change that technology and digital devices can deliver. Because Couch to 5K is fairly famous. For those of you that don't know about it, the idea is that if you want to get into running, but you're not sure how to get into running, you download the app, and it really guides you through a step-by-step process of basically getting off your ass and going for a run. But it does it in a it's a really it's quite a sophisticated. It's use of nudge technology or nudge behavioural theory to encourage you in smaller increments to change the way you sort of live your life by getting you active. And by getting you active and getting you fitter, that's a preventative measure, which in the healthcare world, again, tight budgets and stuff like that, anything we can do to make people more aware of their own health and make them kind of look after themselves a bit better is only going to be good for the healthcare sector and the challenges facing that going forward. So this is like a good example of behaviour change, which is almost self-service. So it's teaching you to look after yourself a bit better so that you don't need to put a strain on healthcare later on. I could go on and on, but I think I would much rather hear from the experts in this field. So I will hand back to you, Gabby, to talk about the panel.
No, thank you, Rich. That's really great and gives a bit of scene setting, as Rich said, before we dive into hearing from the experts themselves. So just before we do these intros and we get everyone familiar with the panel, just a quick reminder, and I think I've said it twice now, but there will be a chance for questions at the end, so please do get your questions in and get asking anything that you're desperate to know the answers to. So right, without further ado, I am going to get everyone familiar with the panel. So hello everyone, thank you so much for joining. Lovely to see all your faces again. So if I can just do a quick whiz round and get some introductions, and then if you can just tell us who you are, a little bit about yourself, what you do and how you, I suppose, relate to this topic, that would be amazing. I am just going to go round the screen. Maybe, Rich, if you stop sharing the deck, then everyone's faces will be nice and big on the screen. But Paula, you appear to be on top of my screen. This is definitely not favoritism of anyone. But Paula, can you please kick us off with some intros?
Hi everyone, I'm Paula Baird, Programme Lead for delivering, linked to the Scottish Government's digital health strategy and equipment, accountable for delivering a programme of work based in NHS education for Scotland. My background is I've been in commercial organisations, local government, housing and health. My background really balances people, process and technology with data overarching that. So that's sort of a whistle-stop tour.
Thank you so much. And I'm going to go this way. So if we can have Isabel, please, next.
Hi, sorry, I've got a very croaky voice. My name's Isabel Jones. I'm the CEO of the charity Alive. We're a very small charity based in Bristol, in the southwest. We work predominantly with older people in care homes, providing engagement and activity. And we've developed huge amounts recently online using technology, and how we can enhance people's quality of life and engagement through using technology. We're one of the first people to ever use touchscreen technology with older people with iPads, and it's amazing. The kind of, you were talking about enhancing lives and the other aspects of healthcare, and technology can be incredible in supporting people with their quality of life in terms of mental health and emotional and spiritual well-being, as well as physical well-being. My background, I've marketing predominantly. I've been CEO of Alive for 3 years. Just before the pandemic, I took it over. So it's been a bit of a challenge, but it's been absolutely amazing. I've got personal interest in dementia. All my grandparents had dementia. So for me, leading a charity like this is absolutely so close to my heart, and it's wonderful to really make a difference.
Oh, thank you. Sounds incredible. And Alan, please, can you introduce yourself? Oh, I can't hear you, Alan. I think you might be on mute. And thank you.
Sorry, I just unmuted myself. Sorry about that. I'm Alan Melvin. I'll start again. I'm a very close working ally of Paula Baird, who you've just heard from. I'm a civil servant. I work in the digital health and care team in Scottish Government. I've been my background, I've been a civil servant for just over 25 years now in various roles. But in the last 15 years, I would say, I've been at the staff experience side of our health and care workforce. I first went into that field around 2006. So I took that experience into the digital health and care world about 8 years ago, and it has been a very long, interesting journey. Always changed, especially during the pandemic, which we'll come to shortly. So my side really is on the staff side, on the staff experience, on the human aspect of it, and the learning and development, and last but not least, the huge leadership and cultural development around.
Amazing, thank you. It's so lovely to see lots of experience in particularly different areas and sectors as well. I'm already very excited. So Chris, you are next on my screen. Can you please introduce yourself to everyone?
Yeah, Chris Sawyer, Innovation Lead for Digital Health from Innovate UK. For the last 5 years, I've been leading quite a large program called the Digital Health Technology Catalyst. Background has always been around medical technology innovation. So industry for about 20 years or so. Worked with the NHS with innovation hubs, and then moved into Innovate UK about 8 years ago.
Wow, amazing. It's super excited to ask a couple of questions, which I know the emerging and innovation things is going to be very exciting to hear your thoughts on that one, because I'm sure you're seeing some very exciting things coming through. So I will save all of that until later. But Alison, can you please introduce yourself?
Hi everyone, I'm Ali. I'm the Senior Product Manager for chatbots at Flow. So I run a big team of people, which is a virtual assistant chatbot. So for people who don't know what Flow is a period tracker. It's the largest one in the world. We have 43 million monthly active users on Flow globally. And you can log your periods. We predict periods, ovulation with extremely precise accuracy. Even for women who have irregular cycles, but we're all about empowering women to understand their bodies better, understand their cycles better, get better health outcomes. So I've been at Flow a year, but before that I worked at Bupa for about 8 years. I worked across clinics, digital healthcare, even startup within a corporate, back in care homes, and prior to that I was at Cancer Research UK in innovation and healthcare as well.
Thank you. It's incredible. And last but definitely not least, Sue, can you please introduce yourself?
Good afternoon, everybody. My name is Suhan. I am the Innovation and Digital Ecosystem Lead for Digital Healthcare in Northern Ireland. So very similar to lots of other people have. I've come from private sector about 30 years ago now in the health service. And 20 plus years in the health service, and started off really as a program lead to deliver IT systems within the hospital setting. and then became interested when an opportunity arose to start looking at using digital solutions to benefit patients and citizens. So rather than actually implementing systems, I was really interested to see how the same type of technology could be applied to improve quality of care, but more for the, that patient directly could use and service users could use. I suppose my current role requires me to try and promote digital as an enabler for innovation. We know loads of innovation has taken place, but quite often some of the innovation has taken place without digital. We want to see whether we want to be able to, and they come to us after they've started the innovation and say, "Oh, we have some digital, please," and you go, "It doesn't quite work like that." So we want to try and say, you want to engender, think digital before, think digital first, but think digital and data before you actually start your innovation. And in some cases as well, not only does digital become an enabler, it can actually drive the innovation. It can be the driver, it can be the reason for the innovation itself, but obviously managed in the right setting and with the right people. So yeah, interested in all things digital data, and I suppose in terms of innovation, have worked across different projects, European projects, ranging from dementia to frailty to stroke to you name it, probably mental health is probably across the piece in all areas.
Wow, thank you. See, I did tell everyone it was a very expert panel. I mean, wow. So I guess the first kind of question that I kind of want to pose to the panel, and one that kind of follows on from, I suppose, where we were introducing and where we were kind of starting with that state of play, is really kind of your personal experiences and what you've seen being in the sector around how digital healthcare has transitioned, has changed since the start of COVID, really, and how you've seen it, kind of living and breathing it and being in the sector. So I don't know if I kind of team this one up. I'll start with maybe like Alan and Paula. I feel like you come as a little bit of a pair, and you've probably got the different sides of the coin to come at this one. So yeah, Alan, I don't know if you want to start us off, and then Paula kind of feeds in from her perspective. Alan?
On you go, Alan.
Yeah, I hear you. Sorry, what was it you want me to do? Sorry, I broke up a wee bit there. Sorry, guys.
No worries. So we're kicking off with what are the changes that you've seen with kind of the perspectives around digital healthcare since the start of COVID. So if you can kick us off, and then I will can feed in.
Yeah, so right. Okay, some of the changes, right? Okay, some of the changes I've seen, in the last couple of years are the rapid uptake of technology and platforms, and the need to have to do it to continue the service. I think in the past, the reason I put that at the top of there is because up until that point in time across Scotland, I mean, across the digital health and care side, there was a lot of perceptions around it being about IT technology, which it predominantly is, but you need the staff and you need the people behind that to run that, and you need people in place to lead that. So since the start of the pandemic, people had to adopt to that because that was the way that the service had to go. So we had to really react at pace and create learning and development on various platforms, Microsoft 365, all that kind of, and Near Me, all that kind of stuff, so that we could deliver those services to our patients and service users. And what you do find there is that patients and service users, a lot of them are quite techie savvy, so they're demanding that, and at the same time, we have to get the workforce into that space. So that was one of the biggest changes we saw right at the beginning. That it was a case of one of these cases where it could be careful what you wish for, because we tried to plug that gap for years, me championing the workforce side of it. Because when the pandemic hit, we got that and we were thrust right into the spotlight there. The staff had to be there at that at that time to be able to manage that, and we really had to react alongside it. So there was a huge cultural impact right from the offset.
And for you, Paula, is that a similar thing you saw or kind of differing?
I think what COVID did demonstrate that people could adopt technology and start to build the confidence to just try, instead of attending like classroom training events and that. It was M365 and Teams was rolled out at pace and scale across NHS Scotland. And then it was resources were provided, but people really embraced trying, which again sort of develops the confidence in using technology. And actually technology is going to be central to how we remobilize after COVID. And also leadership and digital leadership, and that digital mindset is critical to that, from executive right through all levels of leadership. We've got a digital leadership program that we're expanding across health and care. Our last cohort had over 70 people, and we also introduced teams that were working on digital projects within health and care to support deployment. But ultimately, the critical part is leadership at all levels for how we keep the pace and scale of using technology to move forward, because we can't just sort of revert back to old ways of working. We've got to continue the pace and even get quicker and smarter at it.
It's really interesting, that kind of big thrust that kind of forced everyone to have to do things and change ways of working really quickly. But as you said, that kind of need for culture change and like giving people confidence as like that secondary thing that it's easy to, you know, not forget. You don't want to forget that, because that's really important to get the most out of the technology. And Chris, from your side, Innovate UK, where you're focusing on innovation, particularly in digital health perspective, have you seen a big change in the kind of projects and what you're looking at, or is it?
Definitely. Because with my kind of looking at it from a medtech perspective, because I also worked in telehealth going back to kind of about the early 2000s. So it kind of went from being more of a push technology to more of a pull technology overnight. So there was this massive shift from businesses kind of trying to push the products onto NHS or health systems to being more of a more working in collaboration and partnership regards getting, you know, patient solutions to benefit patients more rolled out more quickly in response to the COVID pandemic. From a development perspective, you know, the program I was running was all about collaboration. So it was about collaboration with not just NHS in England, NHS across devolved administration. So we've seen a huge amount of collaboration between SME-led projects and clinicians and NHS workers, which has been absolutely fantastic. And I think that needs to continue, because one of the key aspects that we need to get right is the design of solutions, rather than having products which are designed by companies and then kind of, you know, promoted and sold to the health system. So that is something that needs to continue. And on the development side, one of the challenges was obviously access to the support people to support the development of products, which meant that there was a delay in the completion of projects. So we saw delays up to about 18 months, which was fine. You know, we start with the projects, and we've seen some fantastic projects being completed. With actually the last one for the program, I had the project completion meeting today, so which was a very successful project.
Incredible. No, and it's so interesting. Rich will back me up on this, but often when we do these Tech for Good talks, it doesn't quite matter what the topic is, which fantastic topic we're talking about, but collaboration and partnership always comes out so strongly. So I think it's really interesting within the first kind of question, we're already getting that strength in the change and the need for it, and how that's really positive and needs to continue.
Yeah. I think just to touch briefly on two other aspects, I think I don't know if it's really been recognized that a lot of the companies really stepped up to the plate and really were really flexible in working with the health systems regards kind of providing services for free for quite a long period of time. Which has its long-term positives and negatives, because you know, there's, you know, some people kind of question kind of the long-term value on getting something for nothing. So you know, that is one kind of key consideration. Yeah,
absolutely. Really interesting. Definitely something I think that we'll come back to in a little while. And from like Isabel, from your perspective, where you use technology is so pivotal to what you're trying to achieve, what changes have you seen since the start of the pandemic?
Well, we've seen a massive openness with care homes to actually embrace it. One of the problems that we had before were care homes just wouldn't understand it, didn't want to engage at all, but they had no other choice. They were it was the only way that they were going to get engagement for their residents with loved ones. And, we'll all remember those shocking scenes that we've seen with people at windows and things. And we suddenly saw care homes who we tried to teach to use iPads before, no engagement at all, suddenly using Facebook portal, and we're linking up with, with relatives. And it was really, really encouraging to see. What we have seen is actually some of those care homes go back a little bit, because actually once care homes could open up, obviously it's more important for the touch and and that sensitivity of that one-to-one. Nothing can ever replace that personal contact. But what we are finding is quite a lot of homes are still embracing it, which is really good. Part of the work that we did was that we were delivering activity sessions over Zoom into care homes, which worked brilliantly in some homes, but not in others, partly because some of the care staff found it difficult. They didn't know how to link up an iPad to a TV. They didn't have the expertise, and they were very stressed, and understandably. So we were talking to them, and they said, actually, what we do want is we want to be able to use technology, but in a space that we can control and not necessarily sort of live. So that's why we've developed an online activity platform, which they can subscribe to, because actually they're asking us, that's their need. They can control it, they can deliver it when they want. But as we've always said, actually, technology is fantastic, but you need to have that input with the person as well. And that's what care homes are talking to us a lot about. But it's maintaining, I think, that the strengths and the capabilities within care staff to use it. And my local authority were saying that we're going to dish out NHS email addresses. We're going to try and get care homes on board, and probably only about 30% of the care homes that have been put online are actually using them. So we're starting to see that actually care homes need so much support in getting on board and improving that. But I think it'll happen, because care homes are still dealing with COVID. We had a session yesterday and it was still cancelled through COVID. So people don't realise that it's still happening. So, but the lovely thing is we have seen people embracing technology and looking for new ways of supporting their older people.
Yeah, and having that diversity of an offer option is really interesting. And Sue, from your perspective, similar changes, different changes, what kind of have you seen in that particular space?
Yeah, I suppose we saw loads of innovation taking place from the healthcare professionals themselves. And I think this is where I think the digital skills piece is really, really important. I think those who had had experience with using digital, they were much more keen to embrace digital. So we had physiotherapists, on the one day they were teaching people how to do their exercises, suddenly having to hold a tablet and have to record themselves to do exercise so that they could send those videos to their patients. So there was really kind of, lots of kind of innovative things, and then using, digital communication then to circulate these, digital videos to the right people, because everybody knew, kind of advice with guides, lots of guides that came out, how-to guides and how do you do this, very simple guides. So we had lots of work that was done to try and support, recognizing that the staff was trying to innovate and do things differently. We had lots of support to try and support them to do things differently, and even the use of apps. People who again were confident in using it were finding difficulty, so we spun up an apps library, for example, to try and give people a place that they could actually download apps that were at least had some assessment framework, so they could at least know that the apps that are on the library were not just any old apps that might sell their data or breach their data, but they were ones that had gone through a rigorous assessment process, and that helped to guide and give everybody a resource that they could either use for themselves and start playing around with it, but without the kind of worry about am I doing the right thing here by introducing these things. The innovation from that point of view were just happening all over the place, and I think at this point we're from an innovation point of view, we need to kind of look at it again collectively, understand which are the benefits and how long lasting are which ones actually will have long lasting impact and value that we can then start bringing in and adopting it more widely, or tweaking it and adopting it more widely. And I see lots of people nodding, because we were all in a place where all of a sudden, just things just changed overnight. So people, were very, very creative. I think that was really a positive thing out of that. I think secondly, I think was the use of data. I mean, all of a sudden, from nobody, interested in your, I think maybe prior to the pandemic, maybe people who were on the waiting list were paying attention to the waiting list, but everybody else was just paying a cursory, all right, that's affecting everybody else, not me. But all of a sudden, everybody was interested in data. We had dashboards after dashboards, people complaining if they didn't see the data on the dashboard for the day, which is a big, change of the public's perception, the public's willingness to consume data and use that data for their own benefit. I think it's a really big plus in terms of raising awareness about the potential of what data can do, how they can use the data, how they can use it to decide, on different things. So I think that was really, really helpful for just kind of raise the whole. We can go back to data at the forefront of most of the work that we do. And then, yes, I think Chris indicated about the whole collaboration and the willingness, I think, for everybody to pull together, whether it's digital or non-digital, from PPEs. Everybody, remember the early days, everyone offering to 3D print your PPE for you, or people doing your protective out gears and things like that. So again, that whole willingness to kind of work together, I think it's something we should try and understand and maybe retain, because I think if we do all work together, we can actually come together and solve problems really, really quickly. And I think that's something we need to kind of pay a bit more attention with and see what we can harness for the future.
Yeah, absolutely. And it's how you can harness it and how you can harness the good findings as well, to make sure you're kind of keeping them with that strategic mind when you can have a minute to breathe and think strategically, which I'm guessing is quite nice for everyone now. And Alison, last but not least, as Flow well established using digital already, like what changes have you seen?
Yeah, I was going to talk about Flow because I was actually at Bupa when the pandemic happened, and so my experience at Bupa is very similar to probably what the NHS went through with a digital transformation project. But the startup space is extremely different and had a very different type of pandemic. And in women's health, or femtech as it's called, we've had a massive acceleration of growth. So a huge growth in startups, and like Flow probably at the start of the pandemic was a startup. It's now a scale up, it's now, on the way to becoming a unicorn. So, I was at the Women's Health Innovation Summit in Basel last week, and you can see just the massive number of startups that are in fertility, in menopause. And this is not just in the UK, this is in France, in Switzerland, in Spain, in the US. There's been a massive boom. The big change that's come is that what these startups are doing, particularly in fertility and menopause, is that they're making healthcare accessible and affordable online, so that you can have a digital fertility remote pathway through a clinic for a fraction of the cost of going to like a private clinic. So it's going to really, I think, change women's health forever. And I think we're going to see a big revolution in women's health now over the next 5 years. And I think, the pandemic, has really accelerated that.
It's incredible. Wow. So interesting to hear, and kind of that whole concept and how quickly things can happen. And Rich, I don't want to ignore you because I know you've got tons of experience and knowledge, been in this space a long time. So, over to you. What changes?
I think, yeah, for us, it was interesting through the pack. Obviously, we're looking at it not from within healthcare, but somebody who provides services to people that provide healthcare, if that makes sense. I think there's a couple of things, just interesting points to sort of pick up from what the guy said, and kind of following on from what Alison was saying there. We've seen a huge uptick in the amount of startups in the healthcare kind of sector that have been coming to us with all kinds of wild and wonderful products and opportunities out there, and that's kind of it's kind of good to see. Sometimes it can be a little bit nerve-wracking because you're like, wow, the heritage and stuff like that is, and some of the ideas are kind of wacky. There's a lot of blockchain stuff that was sort of kicking about that was kind of interesting. And I think what's when Sue's talking about like looking at the long-term impact of an app and how an impact can actually help with a provision, that's really kind of fascinating. So for the sort of startups that Alison is maybe referring to, where you're kind of an entity that gives you access to that range of services on its own, if you like, that's great, because you have that sort of survival of the fittest kind of thing, and what will work will work. What we have found interesting is when we've actually worked within our health service with technology providers, and we've had a couple of different things where we've sort of looked at it, and we've gone into actually our local health service, the hospital, to look at how they do inductions and stuff like that. This is not getting in too much into the weeds, but what we found was the last thing the guys that are actually delivering the service needed was another bloody app that they had to download and manage and administer and all that kind of thing. So that ROI and what the impact is of technology it's a really important thing to bear in mind, given the kind of the stresses and strains that are already on a workforce there. So it's getting that balance. There's a lot of abandonware is a word that's not kicked about quite a bit in the health service of people, consultants. It's that classic thing. Consultant goes in, sells this thing, here's the technology, there you go, no provision to look after it, to maintain it, to support it going forwards. And 5 years later, you've got a load of people that don't really understand why it's there in the first place, that have got this just another bloody thing to do every day that they don't really need to do. So we found that quite interesting. And interestingly as well, what we really found was we had a big, and I think this is kind of, I don't know whether this is pandemic related or just a more natural thing, but actually in mental health, we have the uptick in people that want to provide mental health provision via digital technologies, just because the provision isn't there for people at the moment, and they're just dying to, they've got this information and they've got this data and they want to hand it over. And that's kind of, that's always an interesting one for us, because, when there's a lot around child and teenage mental health, particularly, there's feels like a bit of an epidemic of it, but not always convinced that another app on their phone is possibly the right thing for that. So to Isabel's point, the technology being used in the right way, but not trying to take over other forms of therapy or whatever it is really kind of important to get that blended experience. Feels like it's a really sort of important thing.
I just wanted to pick up, because I actually think the mental health is almost like it's sort of paving the way, and I think women's health is going to follow, like what we've seen mental health go through. Personal mental health, there's obviously a massive strain on the NHS, so a lot of people turn to the private sector, and that's why Headspace, Calm, Silver Cloud, they've also seen a massive growth in users. People are very happy to spend 40 quid a year on Headspace and learn about CBT and do that online. And Bupa recognised it too. Bupa, one of the first things in the pandemic was to give Silver Cloud access to all corporate members. They gave Babylon access to every single member of Bupa as well. So they recognised that there needed to be like an online pathway for mental health, because there was such a demand. And I think women's health, which also has the same problems in the NHS with very restricted access for a lot of women in terms of fertility, menopause, hormonal health, contraception. So I think it's going to follow the same way, where people are going to be looking to what they can get what they can see on the App Store, which is cheap, and where they don't have to sit on a waiting list and they can get support quickly.
I think it's really interesting, and it kind of comes back to Chris's point I think you made around like the design of products and keeping that in mind and how that's best to serve the user. I think that's super important, because I think with mental health, I think Rich alluded to, like, is the app the right route for that? But it's actually also like sometimes that feeling of it being slightly more anonymous is like a really great entry point for people. And there's a lot around kind of these, particularly that feel more sensitive kind of issues, actually like dipping your toe in something that feels kind of a little bit separate from you can be really good. And I think keeping the users at the heart of that, speaking to real users, understanding what their motivations are, what their needs are, is really like a key point. Because I think often throughout the pandemic, what we've had to do is solve the problems really quickly. And now there's time to actually be like, are they solving the problems? To go back to Sue's point, like, what's the data telling us? Like, what do we know? What have we learned? And how can we iterate and improve? And I think it's also a time to be listening to people, listening to users that have had these experiences, and being able to iterate and move forward in that, which is a really interesting, exciting time, and one that I think we've all kind of mentioned on the call today, feels like quite a pivotal turning point in terms of what the future of digital health could look like in the future. I do have a question which has come through from someone on the call. Is anonymous, so unfortunately I can't use your name, but I will be obviously sharing your question. It really links to actually my next question that I was going to ask, so I'm going to just dive in and kind of ask this question, because I think it's been mentioned a little bit already, but actually what are the panel's thoughts on do we think acceleration of digital products is going to slow down due to the fact that COVID is less prominent? So I think there's lots of like shaking of heads. I mean, Paula, you shook your head then, got around that.
If you think of the backlog of patients waiting for care since COVID, we've got to keep the pace going. We've also got to be mindful of the workforce is tired as well. So it's about how do we get the balance right for technology deployment and the adoption of that technology? But we've got to keep the momentum going and find innovative new ways of doing that.
Yeah. And Alison, there was a really strong head shake from you there.
Absolutely not. Like, I think it's gonna, I think what the pandemic has done is kind of laid open some of like the massive problems with digital pathways. At Bupa, they knew they had to create a proper digital pathway fast. They haven't done it yet, but they will. Like, people want to be able to go online, search for a consultant, view a profile, book an appointment, have a video call, be able to like have remote diagnostic tests, have a follow-up online with your consultant after your treatment, be able to see all your notes on an app. That's what the digital experience should look like for a healthcare pathway, definitely in the private sector. You won't even get that if you went to Spire or HCA right now. You wouldn't get that, if you went to Bupa or Vitality or AXA, but that's what it should look like. And that's what people expect, because that's what they have in travel, in banking, they have fully digitized pathways. And people are like, why can't I book an appointment with my cardiologist? This is nuts. I think it's really shown where kind of the healthcare sector needs to be, and I think people want it fast. So, yeah.
It's a really interesting point, actually. There's a concept in usability design. It's a thing called the Kano Model. This might be getting a bit into the weeds, but the Kano Model basically, it's a bit complicated, but basically what it's saying is the thing that a thing that somebody finds delightful at the moment very quickly just becomes something they expect. And a really good example of that is pinch to zoom on a phone. How you pinch to zoom into a photo. 7 years ago, when that was invented, it was like the most magical thing in the world. And now if you try and use something and you can't do that, you're pretty disgusted at it and throw it in the bin. So that's the same with that type of user flow that you've just talked about there, Alison, that you get that. When I sort of talked a little bit at the start about in fintech and in financial services, that cost to serve thing, they're used to being able to get that stuff because those industries have been able to invest so heavily in it. And it's kind of we need to catch up with that in the healthcare sector now. The good news about it is a lot of the hard work's been done by those guys. So I think, they might be a bit gross and horrible, but don't be like scared to jump on that and use those technologies that are there already. There's clear a lot of the problems are solved, so it does open it up for healthcare. One of the advantages of following on and not being an innovator is you can kind of surf in on the back of it, and you don't have to waste billions of pounds trying things that don't work. So
yeah, absolutely, that's smart innovation. And sorry if anyone's joining us from the financial sector, I'm sure you're the good one. I'm sure you are.
I love them all.
I just want to come in on that because I think a lot of it is around, it goes back to design again, but not necessarily design of products particularly. I think it's systems design and how health and care will be delivered in the future. And that's where digital comes into this. I think digital is ultimately the enabler to the improvement of how health and care is delivered. I think that is one of the absolutely massive benefits of digital. And this is only my opinion, but I think digital will end up being kind of normalized. So we'll probably end up not calling it digital health. It will just be health, and digital will just be, and as I say, an enabler to delivering the health and care that the system needs.
I completely agree with that remark, Chris. I mean, we've always said, in years to come, should we really need a big digital health and care strategy, because it should be business as usual, and that's wishful thinking. That's really where we need to get to. But me personally, I don't see there be any slow down in the uptake of technology and stuff. It's certainly not in this climate. But I am a wee bit cynical, though, because I've been at the workforce side for so long, that the people's mindset sometimes does slow down a bit, and sometimes it might return back to where they were before. So as Paula was saying, that's up to us to keep on top of that and have that leadership in place, so that the people that are driving it forward and having to use this stuff every day are using it because they can use it and it's worthwhile using it, not because they have to use it. And things don't bottleneck, at certain areas in the service, so that people are embracing it more than just having to use it. And that is a challenge in itself. But we're in the right space to do this now. But it's quite a big task.
I think that's a really interesting point, and actually like sharing that value with people that are on the ground using it, like how it's going to help their lives, I think is really interesting. That nervousness, I think if they can see that value for them and understand that and be taken on the journey, because if they're kept at the heart of that and it's making their lives better, that's a really powerful thing. And it does lead into my next question. Just going to apologize because some builders outside have decided to do some very noisy work in true webinar style. So apologies if this gets noisy. But we have had a question from Debbie, who has asked, does the modern workforce have different digital expectations of organizations in the workplace? So I think that kind of leads on, Alan, from what you were just talking about there around some of the slippage, maybe some of the tendency to go back. Are you seeing a younger, more modern or like workforce demanding the use of digital to make their lives easier? Is there any difference there?
That's quite a big question. That I would say, well, depends what I mean by a modern workforce. I think the workforce is made up of so many. I mean, obviously, just across NHS boards alone in Scotland, there's 165,000 employees. Like in the last count, I think it added in the health and social care aspect as well. Paul, I can't remember what it's up to about
360,000.
Something like that. So. That, and some of that's very much still a grey area, because it's a huge area to look at. But I think when we talk about a modern workforce, I mean, there are people in that workforce there who have been on leadership courses now for many years, and there are people that are ambassadors in their own areas, and it's about how we scale that up. And of course, there are the naysayers as well that will just get on with what they do. But speaking from my own experience, I mean, I went through a major health issue just around 2.5 years ago, and I spent just almost a year in the hands of NHS. It was a very surreal place to be after working with for so long. There I was, at hospital for instance, I'd been out in boards anyway, and I could see, but I really saw firsthand how it run off the feet, the frontline service staff are. So you can see why people are just keen to get on, coming in, doing their shift. They don't want any interruption. They haven't got time. They are absolutely, just bursting at the seams here. The work's, you're falling off the desk, if you like. But So again, I think it's just getting that balance. There are people there that we can tap into to have the great leadership and will demand the best to do their job, and there will be others that that are quite content to stay where they are and don't really want to adapt to change. And again, that just comes back to the leadership aspect of it and how we channel that right across health and care. And I think just to finish that part off for me, I think it's about harnessing what we've learned from the pandemic, taking that digital first approach. Now, digital first probably wasn't always the best reference to use either, because people can interpret that differently and what it means to them. Some people get a wee bit upset by it, but it's about balancing that digital first stuff with a blended approach and building the two worlds together, so that digital is an enabler, but there are still working practices and things that do go hand in hand. So it's not necessarily replacing one with the other. It's actually complementing the journey, if you like. And at the end of the day, it's all tailored to the patient and service users who really don't differentiate between clinical and non-clinical at times. It's just really getting from the GP through the service out the other end. So again, there's that patient journey you have to think about as well. So I think it's just more about getting that leadership right, so that we promote this and roll it out in the best way possible.
Amazing.
Yeah, just wanted to come in on what Alan said. Get them going. As long as the digital can help them make their life easier or more convenient, improve their efficiency, or enable them to work, much better. I think those type of digital are much easier to assimilate and use. But I think to the point, I think in the future where I think if they are able to, we're looking, because of the fact that we are now collecting more data, and the fact that we then are going to be able to harness these use of these data to help make decisions. So it goes from just being something that will make your life more convenient, but actually becomes a decision support tool. I think that's when we will see the real gains, because the individuals will feel as if it is not only just going to be a nice to have or something that will make them work quicker, more communicate things better, but actually when it becomes a real decision support tool that actually can augment the decision-making process, can actually give them additional information to make better decisions in the future. I think when it gets to that point, I think the workforce will be, that's when we actually, I think, get the full value of digital and data manifesting itself in the decisions that they are making on the day-to-day. It will make the big difference that we're looking for.
Yeah, I was going to say it's about, I think with the workforce, it's about communicating to them how it can improve the kind of experience with the people that they're serving as well. Because for example, like acoustic monitoring in care homes, the way that's working at the moment is enabling care staff to be able to spend time longer with the people that actually need them, as opposed to kind of walking around every night checking people every half an hour. With acoustic monitoring, you can find out who actually needs that support and let the people who need to be left alone to sleep better. So actually their quality of life is improved. And I think, care staff are beginning to see that actually technology can be used in that really good way to improve the quality of life. And it's not actually taking away from their job, but actually enhancing their job and allowing them to do a better job. And I think it's that kind of communication that's really important.
Yeah, and I think again with the demands, like being able to know that as someone trying to deliver that brilliant job, that you're spending your energy in the maximum areas for impact is really powerful, instead of going home at the end of the day like, wow, I could have done so much more. It's kind of like helping with that, which is really amazing. And if digital or anything can support with that, it's definitely a good thing that we want to encourage. I'm super conscious of more questions to get through and limited time. I mean, always the way we extended the time, but there's just, I feel like I could speak to you all for a week, not even a day. So I'm going to do a kind of quick couple of more questions and hopefully get that in before we have to say goodbye. So I think we've covered some of the challenges around like a digital health adoption and actually the changes that we've seen. But I guess it would just be great to like whiz round and kind of like do your one biggest challenge as kind of a takeaway for people that are here today. So I'm going to start with you, Rich. Just going to throw you in the deep end and be like, from a three-sided key perspective, what's kind of the biggest challenge, do you think, that we've seen?
Right. So what the biggest challenge in healthcare, or the biggest challenge with
in digital health adoption, I think, and the kind of maybe what we
Okay, so I think definitely for us, and I sort of alluded to it a bit earlier on, and this is looking primarily at the NHS specifically, but the biggest challenge we have with any work we do with the NHS is the like the size of it and not having the systems in place to have a joined up kind of concept of it. So when they're bringing in outsiders, for want of a better word, or bringing in an agency to help work with them, there's too many. It's never a one-to-one conversation. It's got to be a collaboration between the people providing the service, the people that are dealing with the infrastructure to provide the service on, the people that are affected by it, so the end users. It's a very large thing. This isn't anything. This isn't rocket science that I'm telling anyone now. I'm sure this is all stuff people have heard before. But trying to solve the types of problems that you're trying to solve there, it can feel very monolithic and very difficult to understand how you can really deliver proper impact and not just deliver something that will tick a box for 6 months and then be lost. I think that's the biggest thing we've faced, really.
It's really interesting, and that meaningful change is a really important aspect. I'm just going to whiz around the screen because I feel like it might be easier. So Paula, you are next on my screen. What's your big challenge, you think, around digital health adoption?
It's all about people. It's about people knowing when, where, and how to use technology. And actually, when you and also getting the technology, because there's still a lot of manual processes, paper processes, and it's about how you move away from paper and use the technology that's there. So it is all about people adopting the technology that's there and being ready for the technology that's coming. And overarching that is the leadership.
Amazing, thank you. And Isabel?
I think the people that we've met in the community, it's actually the fear of technology, especially with older people. They're completely, some of them are amazing at adopting it, but a lot of them aren't. And actually it then leads to a huge digital divide because they feel that they can't access their GP. They don't know how to, they don't have Wi-Fi, and you might teach them how to do something, but then if they've got an issue, they then don't know how to get back on it. So I think there is a huge issue with supporting older people who are living on their own with technology to access healthcare systems, and we mustn't forget that.
So true, so true. And I'm going to go down. Sue, what's your biggest challenge that you see around digital health adoption?
Yeah, I think from for us, I think it's just sustaining some of these innovation and being able to discern which ones get the real benefits out of each of these innovations, discern which ones are actually worth us scaling and adopting, which ones were only good for what was needed at the time, and being able to know the difference between which ones added value and which ones were only useful for what was needed at the time. And I think the biggest challenge is deriving some of this knowledge and learning from those, because people did them so quickly and not always they had the time to put in a robust evaluation program and all of that sort of stuff. We didn't have the luxury of that. So it's about harnessing that energy and sustaining that energy and momentum, and in the face of so many other challenges that is going to come that's hitting the system, and it's so easy to revert back to this is how it used to be, because before all this digital came along. I know we needed it at the time, but I want to see my patients. I want to see them. I don't really want to see them on Zoom anymore because or virtual, because I want to be able to talk to my patients. But how do you do all of that in view of all the waiting lists and all the challenges? So it's getting that right balance.
Really interesting around that decision making around where to scale, what's good, what was needed for the time and what's needed for the long term. I think that's really, really interesting. And Alison, from your perspective, what's the biggest challenge you've seen around digital health adoption?
Yeah, so for all the startups that are working in femtech, one of the biggest barriers that was talked about the summit is healthcare literacy. It's a theme that we're talking about a lot in digital health space. The problem is that in the UK, many other countries, we have really poor education for women's health. So young people don't get taught about periods, sexual health, reproductive health. fertility, the menopause. And so when you have startups who are doing really exciting stuff like Tune and the Lowdown, you know, they're contraception-based startups which are providing, you know, personalized self-assessments around finding the right contraception, and they're getting traction. But for people to adopt those, they have to know that there's a problem with the way that we give out contraception in many countries in Europe. So you have to be, you know, in quite privileged, quite well-educated position for you to actually understand that there's a problem. So in like some of those startup areas, people don't understand the user need in the first place. There is a user need, but many people aren't self-aware. And I think this is where Flow kind of comes in, because with our kind of scale, so particularly the chatbot I run, that, you know, a lot of the work that we do is making people more self-aware about their cycles, their symptoms, to understand their bodies better, so that when they go in to see a consultant, and say you've waited 3 months on the NHS to see a gynecologist, you can actually go in and be like, see, these are all my cycles, this is how my flow is, these are the symptoms that I have, I know something's not right, like I know this, and I'm very well informed about how my body is and my cycles. So we're kind of equipping people with the right information to be able to go in and have better conversations and improving people's healthcare literacy. But it is a barrier to adoption for a lot of startups, you know, in the space, that people simply don't know enough about, you know, the issues around their cycles, around PCOS and endometriosis and the menopause. And it is a barrier to adoption for, you know, quite a lot of startups, I think.
Yeah, that lack of education piece and not forgetting that. It's really interesting around like having a solution there is great, but you need to know the solution is there to use it. And I think that's a really interesting piece of the wider puzzle that means it can all come together and work really slickly. And Chris, from your perspective, biggest challenge to digital health adoption?
Yeah, it's the same old ones really. Actually, it's similar to Rich, what Rich was saying. For companies, navigating around the complexity of the system. Commissioning processes are still pretty much a nightmare for companies. That long sales cycle. Quite often we see, you know, UK businesses ending up going overseas for a few years, and then maybe coming back to the NHS when, you know, when they're able to sell product. Yeah, it's a really interesting barrier, and seeing some similar themes across the different answers. And Alan, from your perspective, biggest challenge around digital health?
One of the biggest challenges I would say is avoiding duplication.
Yeah.
I think there's a lot of stuff out there. There's a lot of good stuff out there, and it throws up the main barrier around people's perception that it costs a fortune. It's going to be too costly for them to adopt, whereas it's not really. It's really just about a different way of working. And, you know, and for years now, we know there's loads of good stuff out there. There's loads of great stuff going on. But, you know, how do you, from a Scottish government perspective, how do you choose that one thing or handful of things that you really need, not just just a concept phase, and develop it from there and then lead it on, because there is so much stuff there, and we're just starting to scratch the surface of that now. So the avoiding duplication stuff is, we know that there's loads of duplication going on, and some people just won't, you know, they just hold the stuff to themselves. I don't know if it's just a part of their character or part of the organization or what they've been doing, but we really are just starting to tease it out to people. But again, there's so much stuff there, and we don't think it does come at such a high price. It's there to use. And we saw that through the pandemic. I think Chris said earlier on, now we had every day we were overwhelmed by the offers of support coming in, you know, some digital, some not so digital. And we were building up this huge database every day with all this stuff. So we know there's stuff there, but how do we bring that in, and how do we get people to use it, you know, and ensure that our managers, planners, boards know that it's safe to use, all that kind of stuff. So there's a whole range of stuff, but to me, avoiding duplication is right up there.
Yeah, I kind of just come in on that, because I think that is that's a big challenge, I think, for, you know, for NHS as a commissioning organisation. How do you differentiate between the different offers, you know, about the different products which are on offer? Because if we talk about from a quantity perspective, if we still continue to have large quantities of products on offer, it makes a challenge. It makes it even more challenging. So I think the goal needs to be, you know, higher quality of products, and I guess that requires, you know, even more evidence. Yeah,
absolutely. And no, there's never unlimited resources around the stuff, not for the people that need to investigate it, and not, you know, in terms of budgets, they're never unlimited. So actually that's really, really valuable point to make, I think. Like, where do you put that energy? Where do you put that investment that's going to get maximum return when there's so much on offer and it's a difficult market to wade through? I think it's really important, and empowering people with those decision-making tools, I think, is going to be like a really key one there. And again, I think it links back to some of the conversations that have been had around data. Like, people have been using these, have been trying, almost, the pandemic's been a great trial period for people having to use things, and there's hopefully a lot of data. And I think if that can be like open and those findings can be shared and people can actually like get sight of how different solutions are helping people in these scenarios, I think it could be a really powerful tool to open that up to people so that lots of different organizations can see and learn. Because I think what we find interesting about these panels, and what I think is really interesting here, is that everyone's coming from slightly different sectors and slightly different backgrounds. And actually, I think, you know, it's really interesting to get that holistic perspective, not just from kind of one area, which maybe is slightly behind. We see it in the charity sector quite a lot. You know, the charity sector talking to the financial sector can be really powerful, because there's things that the financial sector have done, trialed, invested in, that actually might seem like it's not important for the charity sector, but it definitely does come with a load of learnings and a load of experiences that can be implemented maybe across. Thank you, Sue. I know Sue's got to leave. Thank you so much for joining us. It's been great to chat to you. Take care. Speak soon.
Take care. Bye. Bye.
Thank you. Bye. So yeah, really, really powerful. I think we've probably got time for one last question. And again, it might be a quick whiz round, so I can make sure you will leave at 4:30 and can get back to doing your wonderful things. So kind of a last one, I suppose, is looking at those exciting innovations and trends that you're seeing, the emerging ones that have perhaps come to your attention around digital healthcare. So I guess, again, it would be great to just whiz round and just, if there's any exciting innovations, trends, it can be from in your organization, or it can be things you've used yourself. So it doesn't need to be strict. But Alison, are you happy to kick us off? I'm starting at the other end. Shaking it up.
Yeah, I mean, one of the areas that I think is really exciting is fertility in terms of digital innovation. I think, you know, startups like Bayer Fertility, Apricity, who are French startups, but now working, you know, in the private healthcare space with clinics in the UK, they are creating remote digital hybrid pathways, which are like I said at the start, a fraction of the cost of you going to a private clinic. The reason that's really exciting is because they've realised that there's this massive, you know, huge audience of women and you know, couples who can't get any fertility on the NHS because, you know, it's restricted by postcode, by your age. If your results are too bad, you won't get it either. And you can't get it on your health insurance either. So for many people, particularly in their 40s, they're often left with nowhere to turn. And so these startups, you know, which are working now with some of the private clinics in London, are able to, you know, offer a much cheaper pathway for people who can't access anything on the NHS. So I think this is going to really help, you know, a huge growing, you know, audience of women. And we know that fertility is only going to get worse. Unfortunately, we've got, you know, in our country, the stats don't look great, that our population, in fact, is going to get more infertile over the next 20 years. So we're going to have this growing problem. So yeah, I think the innovation within that space is going to be really, really exciting.
Yeah, it sounds really exciting, and again, a really interesting one to keep an eye on. So thank you for sharing that. Chris, in your space, Innovate UK, what kind of exciting innovations and trends have you seen emerging?
Yeah, I had quite a large portfolio, really, across kind of 20 different disease areas and kind of 6 or 7 different digital technology areas. But some interesting areas for me, particularly interesting, is around cancer detection, real-time cancer detection using AI. There's a couple of projects in there which are looking really good. Number of projects around training and education on using virtual and augmented reality, which look as if they've got huge potential. Some of them are already in the marketplace. And some really interesting voice technology solutions as well, which I think could have huge benefits, particularly kind of from a service and operational perspective. They're just some of the kind of interesting areas.
Yeah, and again, it's really interesting. So VR and AR, there's some really interesting training stuff out there in the market. I know that stuff really already as well.
Yeah, and a number of the solutions which, or the projects that we funded were not so much clinical, they were more operational and service, which is which was adding quality and taking kind of waste out of the system to a certain perspective, to a certain degree, which is, from my perspective, is really good.
Yeah, amazing.
Because I think that's kind of the low-hanging fruit, and I think where we are at the stage with, you could call it AI, machine learning, or just algorithms. I think that's where kind of the near-term potential is.
Yeah, absolutely. You sounded just like Rich then when you said that. And Alan, from your perspective, what exciting innovations and trends have you seen emerging from the sector?
Right, from me, I think there's a couple here, but the one of them we've been talking about, and I know it's easy to think about technology stuff, but I think the innovative part for me really is on this whole digital leadership agenda, given that we've got a huge investment in it now, and we are right at the front of this. So I don't know if it's a innovation or if it's a digital revolution, I don't know, but it's certainly picking up ground anyway, because it's keeping us busy every day, and it's a fantastic place to be in now that we really have got that front seat at the table that we've longed for, for so long now. So again, that's really ramping up across Scotland. But really, just to come back to just really what Chris was saying there, I would say the whole world of AI, because the innovation piece and Scottish Government, it kind of sat aside to what we did and what was e-health and your digital health and care, and that's now becoming closely aligned now, and it's really starting to come up in conversations every single day around AI. So even how we work around the workforce, what does this mean for the workforce for now, in the future? What does it replace? What does it do, for jobs, all that kind of thing. So again, myself and Paul are having these conversations all the time, but understanding all this AI stuff, which is really hot on the radar now. So that to me is the biggest discussion point that we're having just now about this whole world of AI, what it means right across the healthcare service.
I feel sad now that I didn't talk more about the AI-based chatbot that I actually run. Oh well, next time.
You want to add anything there? Because I think it's a really interesting point around what you guys do. Please feel free to add something, and then I can round off the rest.
Well, yeah, I run an AI-based femtech chatbot, but there are a lot of chatbots on the market in this space. But I think where it's going to go is that what we'll be able to do in flow, and where everybody's aiming for, is that we'll be able to look at predictions and patterns within your data to be able to predict that you might have endometriosis, you might have PCOS. So yeah, being able to look at big patterns within symptom and cycle data in order to predict potential risks of with health conditions. So that's where it's going to go. That's 100% where it's going.
It's really interesting as well. I don't know if you've ever done these sessions with people and mentioned chatbots and watched all the faces. It's quite like a divisive topic usually, but the ones that do it really, really well are amazing. And sitting here as a millennial, if I don't have to talk to someone on a phone, I am like here for it. I'm like living and breathing it. I've used Flow's chatbot myself, and it is incredible.
People feel very uncomfortable sometimes talking about subjects like vaginal discharge and stuff, even going to their GP and talking about this stuff. So yeah, the chatbot is a really good, helpfully, for young people, for them to understand this stuff more and understand what's normal for them. So yeah, it's very empowering stuff.
Well, I think chatbots have come a long way as well, and like these sorts of technology that we've been talking around, from like AR, VR, AI chatbots, a few years ago it was all really like, that was quite inaccessible and quite difficult to get your hands on and experience yourself and experience good ones. And I think now actually there's a lot out there. The technology's come a long way. I think, as Rich said, it's been invested in heavily in other sectors, and a lot of learnings have been had, and there's a lot more experience around it. So seeing it implemented more in the healthcare space is really exciting, actually, using all the good learnings and implementing it in a really effective way where people can get information quickly and learn more. It is really powerful. And Isabel, just to come back, because we've got a few more exciting innovations and trends emerging to talk about before we sign off. What for you is kind of the most exciting innovation or trend you're seeing?
I think a lot of it is linked to AI, especially particularly in dementia, actually, and it's really interesting to seeing how it's being used. For example, I was talking to someone the other day, and they've developed a sock that you can actually wear, and it predicts, because it measures heart rate and all sorts of other elements within the body, and it can predict when a person with dementia is potentially going to have a distress or challenging behaviour. So in terms of care homes and people who are managing people at home, a pair of socks completely normal, and you wouldn't appear unusual to be wearing that, whereas sometimes devices previously have been something around the wrist or something that's actually very unusual, and it creates a kind of it shows that you're wearing something, where a pair of socks is completely normal. And actually it really helps to manage the challenging conditions that dementia can bring, and we're seeing so many more inventions like that normalize it but actually help people to manage the symptoms. And also things like it will enable other technologies that we're seeing enable people to stay at home for longer, so that if a person is living on their own, you can use all sorts of technology to do their medication, to make sure they're taking the medication, and with echo shows, all those kind of things, people can just pop in and make sure they're all right. So actually, we're seeing things that allow people to stay at home in their environments for longer through monitoring, and it's going to be incredible. Actually, I think that's only going to grow, that's what we're seeing at the moment.
All of that makes such a huge difference to people's lives and families' lives and anyone experiencing that. So that's really exciting and incredible to hear. And Paula, from your perspective, last but definitely,
I'm excited about the revolution that me and Alan are going to have. So that's going to be fantastic. I think there's loads of things happening. When you think of the potential within health, and if you like technology, that's the place to be, because I think we're just at the very starting point. There's things with Scottish Government with a digital front door, which is going to be a safe, simple, secure digital app that will help patients and people navigate around the services. Linking to what Isabel said, it's about how sensors continue to be developed to support that care at home, and how robots are used to support people at home, not only as companions, but how they take on additional tasks. Remote health pathways, so actually your clinical teams will know that you're going to get ill or something's going to happen before you're feeling any of the symptoms. So all that tech's there and starting to evolve. So it's exciting, and it's about how we support the workforce to adopt that technology, but also how roles will change as technology changes as well, and how we support people through that. So it's quite exciting.
Irene, amazing. We got robots and revolution into this Tech Good Talk. I mean, you guys are my favorite panel of all time. I think on that note, I can't think of how we could possibly end any better than that, and I'm conscious of time. So just massive thank you for all of you giving your time today to share your experience, to be so honest and open about the challenges, and kind of give this really valuable feedback for everyone that's joined us, and for also Rich and I to learn this stuff is really, really incredible. And one last note from me for everyone that's joined us, again, thank you for your questions, and thank you for feeding into that amazing discussion that we had. Feel like we have only just touched the mere surface of this topic, and we could have talked so much more. So if there is any burning questions, or anyone wants to continue the conversation, please do reach out. We would love to hear from you if you've got an idea or a problem that you're looking to solve. And I'm very, very sure that our panelists would also feed into that. So please do reach out, let us know, and let's see how collaboration, which always comes up, can maybe help to achieve those goals and do some good stuff together. So in terms of one last thing to mention, we do have our next Tech for Good talk, which is coming up on the 28th of June at 3 p.m. This one is on how tech can support innovation for good. So we've talked a bit about innovation and how it can be used positively within this talk today. So we'll be diving into that. It's a bit wider and a bit more detailed. So if you've enjoyed that part of this discussion, please do join along, come along and see what we discussed then. Can't promise there'll be robots, but we'll see. Finally, just another massive thank you to all our panelists for all your time today, for sharing so much with us. And we hope to see you all again soon at another Tech for Good talk. And everyone else, thank you so much for joining. Stay safe, everyone, and see you again soon. Take care. Thanks, everyone.
Thank you. Bye.